If you've been told that you have unexplained infertility and you're under the age of 35, this reel is for you. Generally speaking, you're going to be counseled about two major treatment options. Either medicated IUI, which is like a form of gambling where you're trying to increase the odds on both the egg and the sperm side, versus going straight to IVF. If you go straight to IVF, or maybe you play around with medicated IUIs for 3 to 6 cycles and then decide to move on to IVF, listen up. What I see in a lot of cases when I'm giving a second opinion of patients with unexplained infertility that went through IVF, they're in their early 30s, let's say. Oftentimes they will be told, oh, you don't need PGT because you're under 35. And I actually think that this is bad advice because with unexplained, you don't know what is at the root cause of why you haven't been able to get pregnant after a whole year of trying. It could be egg quality related, but we don't have a direct way to test an individual's egg quality. So a lot of the time, the insight that we're getting about egg quality is derived from the PGT testing that we do on embryos that result from those eggs. Going through IVF is therapeutic. It's helping you to overcome infertility, but it's also diagnostic. It's a lot of the time the only opportunity we have to get key insights of all of the things that normally are happening inside of your body. We see how the egg and the sperm interact, how they grow into embryos, and what the quality of those embryos are. So I think it's a shame to give up the opportunity to gain that additional insight because of an old school way of thinking that if you're under 35, you don't need PGT. The newsflash here is everyone can benefit from PGT because even in your 20s, when you're deemed to be in the it's as good as it gets phase of your fertility and your egg quality, even then we see that 20 to 25% of embryos coming from those eggs at that age in your 20s are going to have these chromosomal errors. So anyone can make an abnormal embryo. And if you've been struggling for a year trying on your own and you've failed medicated IUIs, once you get to the point of doing IVF, it just makes sense to utilize that opportunity to gain additional insight into the embryo quality so you can cut through all of those embryos that wouldn't be destined to go anywhere. You can save yourself the heartache, the time, the resources, and the effort of failed transfers and reduce your risk of a miscarriage. We know PGT normal embryos aren't perfect, but they can get you very far. So it is a very useful tool that I often recommend, even if you're under the age of 35, because I want the information.